So, Dr. Mohammed, why don't you start off by giving us a quick introduction about yourself and how you got to where you are today?
Oh gosh, I don't know if that could be quick. Hi, everybody.
Take as much time as
Totally
you
fine.
need. Yeah.
Okay. So my name is Ambreen Mohamed. I am a board certified cardiologist. I am originally born and raised in Southern California. Go Lakers. And very relevant right now. And so I went to college at UC Irvine in Orange County, California. And then I kind of ventured out, literally out of the country and all over the East Coast to do my rotations during medical school. So I went to Ross University in the Caribbean for medical school. I did my first 2 years of preclinical time there. So that's like the sciences and all of that. That was condensed into 16 months. So it was a very heavy time for us. And then we did a 5th semester, preclinical semester. We had choices as to where to go, Michigan, Miami, or stay on the island. So obviously I was going to go to Miami. So I went to Miami. I lived there for a few months, almost up to a year. I took my step 1 there. I did my preclinical semester there. And then I actually did my first couple of rotations in family medicine and OB-GYN there. And then to New York, and I did the majority of the rest of my rotations in New York. I lived all over, Upper West Side, Upper East Side, Brooklyn, pretty much everywhere. And I also did some rotations in California, back home, and then I matched into residency in Park Slope, Brooklyn. To be honest, I wasn't super happy with where I matched. I was really fortunate to get a ton of interviews, but you think that you rank your top 3 and you're going to match there, and I didn't. I kind of matched somewhere in the middle, so I wasn't super happy about that. It was a community program. I wanted to do cardiology ever since probably 3rd year in medical school. I actually had the intention of doing dermatology when I first started medical school, and I know I even worked at a derm clinic, and I was like super passionate about it. And then I started to learn about cardiac physiology and anatomy during medical school, and I was like super fascinated. And then I had a couple of really great mentors during my medical school rotations. One was an elective where a cardiologist sat with me every single day for 30 days and read a bunch of EKGs with me, and something kind of just clicked, and I was like, wow, I get this, I understand this. And as I'm sure, I don't know if you guys have that much of exposure to EKGs, but it's something that even now as a cardiologist, it can be sometimes very nerve-wracking to go through. So the fact that he had the patience to sit with me and actually explain things was amazing. And during my internal medicine rotation, we rotated in a cath lab because we were with an interventionalist for some reason. And we saw a super interesting case. And I think kind of just putting everything together, I even had my dad went through some cardiac issues as well. So putting everything together, I just became super passionate about it. And I just knew that this was something that I wanted to do for the rest of my life. So when I matched into a community program, cardiology is one of those things that is extremely competitive, unfortunately. I mean, fortunately and unfortunately. I mean, there's a lot of, research and everything that goes into it. And so it becomes a very competitive specialty to match into. So I knew that I had to go to a better university program to have a better chance to match in a fellowship. So I made the difficult decision after I went to my intern year, or through my intern year, about maybe 3 or 4 months in, I decided this wasn't going to be the best program for me. So I made the difficult decision to transfer programs, which is something that most people don't do. And they don't advise for you to do, but I was really honest with my program and said that I wasn't happy there, and I chose to look elsewhere. So they actually offered me a contract, and I refused the contract, but I didn't have anywhere else to go. So I had to do a self-search all across the US. I had to cold call programs, email programs. There's not like a website that you can go to where they just post a bunch of job listings and you can apply. Like, you have to be proactive, and there's not that many spots available to transfer into. Luckily, months later, I finally matched into a university program in Connecticut. So I moved there for my 2nd and 3rd year of internal medicine residency. It was a game changer for me academically. I got great research opportunities, met great mentors. It was a great cardiology program. They did advanced heart failure. They had all the advanced therapeutics. So I was exposed to things that I would have never been exposed to otherwise. And so then I again, decided to go off the rails a little bit. And I decided to take a year off after I graduated internal medicine residency to do a research and imaging year in advanced imaging specifically. So I moved back to New York. I did that year, got paid very little. I don't know how I lived. And you know, when I applied for my match into fellowship, the first time I didn't match. And so I was devastated. You know, it was a really tough time for me. But, you know, I was like, there's no plan B for me. There's just this plan A, and this is what I'm going to do. So I'm going to make it happen. And I did. I then did a second year off, and I did a hospitalist year at Montefiore in the Bronx. And during that time I applied again, and then I matched into my top choice in Philadelphia. So then I moved to Philly in 2016, and I completed my fellowship in 2019. I was chief fellow during my time there. And then I just kind of built this, you know, robust interest in cardiac imaging, specifically advanced imaging. And so since I graduated a little over a year ago, I've been practicing in Philadelphia and around the suburbs in Philadelphia. I do something called locums cardiology. So that is when you work with a company that basically outsources you to fill temporary positions basically all around the US, but you can kind of pick and choose where you want to be. The reason why I did that was for a couple of reasons. I wanted to just give myself a little bit of a break. Again, this is off beaten path. Most people don't do this. They'll either just take a job or they're going to do a subspecialty like interventional electrophysiology, things like that. And so, of course, knowing me, I did something totally atypical. But I kind of just wanted to give myself a break. It was going to allow me to travel more, see my family, and then just kind of get my feet wet and get a sense of what I wanted to do in terms of, you know, finding a permanent job. Well, then COVID happened, and I wasn't able to travel. And, you know, doing the locums, I was realizing I love inpatient medicine, and I was also realizing I really miss advanced imaging. So then, of course, I decided to do something, again, very atypical. And I was like, you know what, I want some additional training in advanced echocardiography because I would love to just make this my career. So I decided to apply for some more advanced imaging fellowships, and I matched into a program in San Diego at Scripps. So I'm moving there next summer, and I'm going back to Southern California. Not happy that I'm not going to be making as much money as I make now, but you know what? In the long term, you know, this is going to be great for my career. So I think that's kind of just, yeah, it's a crazy path, but that's where I am now.
Yes, that was wow. That was amazing to hear. So now, could you give us a description about your day-to-day experiences in your field and what a
Yeah.
normal workday would look like for you?
Yeah, so I mean, for me, a normal work day is kind of all over the place, and that's one of the reasons why I love cardiology so much. Because even for a non-invasive cardiologist like myself, so there's a difference: invasive versus non-invasive. Invasive is like interventional electrophysiology, where they do procedures, and non-invasive is imaging or just being a general cardiologist. So it's nice because, and I kind of give this example a lot, you know, I do a mix of inpatient and outpatient medicine. I can go into the hospital, I can round in the morning, I can do a couple of stress tests, and then I can go to the cardiac ICU, I can manage cardiogenic shock, and then I go to the floor and I see some patients with chest pain and heart failure. And then I'll go to the office and I'll manage somebody's, you know, high cholesterol and high blood pressure. And then I'll go back and I'll read, you know, echocardiograms, and I'm done for the day. So, you know, there's such a dynamic mix, and that's just within one day. You know, and even within cardiology in and of itself, there's so many different subspecialties that you can be involved in, even though you don't technically, you know, specialize in those things, that it just makes it such an interesting field. So yeah, my day changes every day, but for the most part, I'm usually in by like 8 or 9, and then I'm usually leaving by 5 or 6 in the evening.
Wow, I loved hearing how much passion you had when you were talking about an atypical career. That was amazing. But within that career, and you talked about this earlier, but I guess narrowing it down, being a little more specific on your day-to-days, are there any major challenges that you've had to overcome? And if so, how?
Well, I mean, there's challenges being a female, right? Being a female physician. There's challenges being a minority, right? And there's just challenges in and of itself because of the pandemic. There's challenges, because I'm fresh out of, considered an early career, attending a fresh out of fellowship. There's challenges because of my age. So, all of that encompassed, cardiology is one of those fields, like I said, that, is competitive to get into, but unfortunately it's also male dominated. And the latest statistics are that under 16% of board certified cardiologists are female. Okay, so just imagine the rest of them are male. And even though these numbers are changing and it's increasing, it becomes difficult, when you're a female and you're already going through this path where, you're in a male-dominated field. People don't always respect what you have to say. They'll second guess what you have to say. I can walk into a room. I'm not always, even though I introduce myself as doctor, I'm not always called back doctor. I've been called, hun, sweetie, dear, all of the things aside from who I am. And so that can be challenging. People can second guess your management because they, say things like, oh, well, you look like you're too young to be a doctor. Oh, are you sure you're credentialed appropriately? And I can't wear my credentials on my forehead, right? I can't tell them that I'm quadruple board certified and I'm more than capable of taking care of them. And I don't have to prove that to anybody. And so that's a challenge. Being a female, even just in the hospital, not even within my own colleagues, but just with, other people as well. I remember a distinct incident not too long ago that really irritated me when I met a male, Caucasian male pulmonologist who was much older. And he didn't know who I was. So I went up to him and I introduced myself to him. And I just said my name. I don't normally call myself doctor to my colleagues, nor to even any of the staff. I just say, hey, I'm Ambreen. I'm one of the, cardiologists. And he's like, oh, can I see your name tag? And he was with a bunch of his team and I was with my physician assistant. And this is just on the nursing floor. Everybody's there. And so I was like, why do you need to see my name tag? And he's like, oh, but he's like, you said your name is Ambreen Mohamed. I want to see your name tag. And I was like, okay. So I showed him my name tag and I was like, I don't know what the purpose of this is. And he's like, had I not seen that your last name was Mohammed and had I not seen that you were here in person in front of me, I would have never known that you're a female. And so I kind of just looked at him and I was like, first of all, he's saying this in public. Second of all, what is that? That's just ignorance. And that's, and so, things like that, challenges like that, where you have to, kind of, what do you do in that moment, And so I corrected him and I said, don't ever say anything like that again. This is completely disrespectful. And you know what my name is. I'm not, clearly not a man. And that's not a comment that you can make, right? And so it can be very daunting. I will say, though, that it is also incredibly amazing that, I am a female and I'm in this field and that I can have opportunities like this where I can show other people that because I've done it, other people can do it too. And a lot of us on social media have really joined social media. A lot of it is for the purpose of being able to encourage future physicians, especially female physicians, to be recruited into cardiology because a lot of people are scared. They don't think it's doable. They don't think that, the lifestyle is doable. And we're all kind of here to say that no, despite all of the challenges and the naysayers and, the haters and the crazy people, we're here to tell you that you can make your life whatever you want and, that these challenges will continue to dissipate as time goes on with us being more vocal and advocating, for our field and for the field of medicine. So.
Yes, I'm so glad you actually said that because I wanted to talk to you about how the percentage is so low. And as a woman and a person of color, I know you have some struggles, on your day-to-day job. So, okay, I have one last question before we start the Q&A session. What information do you think that high school students should know before committing to this career path?
To career path of cardiology specifically?
Yes.
I mean, it's hard, to be honest, it's hard at your level to kind of understand the enormity that you're going to be undertaking when you go into medicine. And the reason why I say that is because it really is an enormity, right? So, when you're going through high school at the stages that you're at, and then you go into college, yes, there can be difficult periods. And I remember those. I'm not saying that I'm totally distant and I don't remember. I do remember. But then you go to medical school, and then you go into residency, and each is kind of its own beast, right? So I don't think that there's anything that can necessarily prepare you for what you're going to encounter. What I will say, though, is that if you have this passion, and I remember ever since I was a kid, the only thing I wanted to do was be a doctor. My parents, I mean, I'm South Asian, so you all know, like, my parents did not pressure me into doing this. My immediate family members are not physicians. Like, I just wanted to be a doctor. And so I was supported with that. And but I had no idea when I was in high school and college, like, how difficult it was going to be in medical school and moving forward. But the passion is what kept me going. So I knew the end goal was for me to help people, and that was going to be my career. So I never gave up on that. And I'm telling you, like, I gave you a very brief story as to what I went through to get to where I am. But, there was a lot of ups and downs, and points where I was like, I don't really know if I can do this. Like, I was struggling, right? But at the end of the day, every time I overcame that struggle, I realized, like, no, it's worth it, because this is going to be my life. And now I can tell you, even if I have bad days, and yes, as an attending, you can still have a lot of bad days. If I have a great encounter with the patient, that completely changes everything. And that makes me realize why I went into what I went into. So I would say keep your goals focused. Keep your head clear. And, as long as you have an outline and you use your time very wisely to participate in research projects that you're interested in, to, join like these pre-med health clubs that could be, in high school or college, to do shadowing sessions like this. And I mean, unfortunately, you guys can't do a lot of in-person shadowing sessions, but once, hopefully once the pandemic is over soon, I encourage you guys to shadow maybe one of your family members or friends that are physicians, or that you might know, because you want to know what the day-to-day life is going to be like. And you don't want to fall into the misconception of being a doctor is all this glorious thing, because it's not. A lot of it is not glorious, right? But you want to see what the day-to-day life is going to be like, and if that's something you could see yourself doing. You want to go rotate in the hospital, go shadow someone in the hospital, or go do some volunteer work in the hospital. And you want to do really well in school. And as cliche as that sounds, your grades and your scores on your MCAT and on your SATs, that stuff matters. I hate to say it, because I am such an advocate for well-rounded people, and I don't think that just solely good grades and board scores matter, because they don't. But ultimately, the admissions councils at your colleges and at medical schools, that's what they're looking at. They're looking at your grades, and they're looking at your scores, and they're going to be weeding you out that way. You want to make sure that when you go to college and you choose a major, you don't have to choose biology. I was a moron and I chose bio sci because I thought that was the right thing to do. And that impacted my GPA, because there was a lot of other courses that I was taking that I didn't do well in, right? But you can do the arts, you can do English, you can do whatever you're interested in, and just take the pre-med courses, which is like a very small percentage of requirements in your 4 years, and you can go to medical school and you'll be fine. And honestly, you'll actually be set apart from the thousands of applicants that are just, standard bio-sci majors. So anyways, I mean, my point is that, keep your end goal in mind. Yes, you're going to have challenges, anticipate those challenges, but if you have a clear outline as to what you want to do, and you use your time wisely, and you have a rubric as to this is what my timeline is going to be, you guys will be fine.
Thank you so much for sharing your journey with us and all those fundamental tips. I know I'm going to hang on to those. So now you guys have heard enough of mine and Vanchika's questions, and we're going to open the floor to you all and start the Q&A session.
Yes, so if you would like to ask a question, just go to the chat room, type it up, or if you want to say it verbally, what you can do is raise your hand and just wait until you're called upon, and then you can ask. Okay,
Oh,
I'll read this one.
oh yeah.
So, Harshgovind asked, what would be your advice to parents of aspiring medical practitioners? Would you have your loved What would you have loved your parents to know and understand looking back that you would have better helped you getting ready for the world today?
Okay. So
Sorry.
basically, it's okay. So basically, what advice would I give to parents whose kids want to go to med school and be doctors? Is that what I'm kind of getting from this? And what would I have told my parents? Um,
Yeah.
okay. So thank you for your question. And okay, so it was a little bit different for me. Actually, it was actually a little bit different for me. So my mom was like super supportive, and she was like, medicine all the way. She herself is a PhD, extremely accomplished. So she was like, I want you to, go do your goal. My dad wanted me to be, obviously really accomplished, but he always saw me as a lawyer for some reason, maybe because I talk a lot. And so he was actually really not supportive of me for a while after I went to medical school, and it took him a while to kind of get on board. He wasn't happy with me. We didn't even talk for a good amount of time. It was a difficult time. So and now he's like my biggest supporter, and is always calling me literally every single day, asking me questions about things that I don't remember. But anyways, that's a difficult question, to answer because I'm not a parent myself. But I feel like if I was to give advice to parents, and I feel like this is probably something that I would, do for my own children one day, is to, be supportive of your kids, irregardless of whatever they want to do. I think that medicine is an incredible field. It is an incredibly challenging field. And, so you should keep that in mind. If your parents aren't physicians, like my parents weren't physicians, I don't think that they understood the amount of challenges that I was going to go through and the amount of some life setbacks that I've had because I've had to put a lot of focus on my career. So, that definitely can be challenging. But I would say that because it's such a rewarding career, and if it's something that your child is super passionate about, yes, there will be some setbacks, but support them, because ultimately they're going to want to do what they want to do. And that doesn't even just mean being a physician. If that means being a PA or a nurse practitioner or a nurse or, a tech or whatever it is within the healthcare field, support them, because I feel like it's such a rewarding career in any respect. And the flip side is, again, because we're all South Asian here, at least you guys are, I don't know the rest of you, but, also don't push them to do something that they don't want to do. I have a lot of friends that, their parents, they were doctors. And so they were like, okay, well, you need to be a doctor. And there really wasn't any other option. That's not the right thing either. You need to just support your kid as to whatever they're passionate with. And if it's not medicine, don't push them into it, because at the end of the day, they're not going to be happy doing what they're doing. And, people have a misconception that doctors make a lot of money and there's a lifestyle and this and that. That's not true. If you want to make a lot of money, go into tech, go into business, because you'll be a billionaire, trust me. But us, no, we don't make that much money. And for the amount of stuff that we do, you know what I mean? It's more about the passion and trying to help other people. So if your kid's passionate about something, just support it, regardless of whatever it is. That would be my advice.
Awesome. So our next question is from Pranavia. She's asking, how many years did it take for you to complete your education?
Oh, Jesus. Okay. Great question. I mean, I alluded to my journey, before, but if you want exact numbers and education, I will include training, because I'm assuming that also includes training, because even after you get your MD degree, that really doesn't mean anything. I mean, means something, but it doesn't mean anything in terms of having to practice, right? So, okay, so 4 years of college, well, obviously 12 years of, doing all of your schooling until you graduate high school. And then it's 4 years of college, 4 years of medical school. So that was 8 years. I took off about 6 months in between college and medical school, but we'll just say it was 8 years. And then it was 3 years of residency. So that's eight. So that's 11. 11. And then I took off 2 years between residency and fellowship. I did an additional year of fellowship in between, but we'll just say I took off 2 years. So that's 4 plus 4, 11 plus 2, which is 13. and then another 3 years of fellowship, 13, 15, and then 15 plus, well, so I'm done, but, and I'm practicing now, but, and then I'm also going back for an additional year, but I guess that doesn't really count because I'm already kind of done. I'm just choosing to do that just because I'm crazy, but yeah, 15 years. And that's average, okay? So that's average for a specialist. Now there's a difference between, you know, being a general practitioner, like a pediatrician that doesn't specialize, a surgeon that doesn't specialize, a internal medicine physician that doesn't specialize, a family medicine physician that doesn't specialize. So general residency programs will probably range anywhere from 3 to 5 years. There's some exceptions. Ophthalmology, neurosurgery, things like that, I'm not going to comment on because they're different pathways, but you know, things like pediatrics or internal medicine, 3-year fellowship, 3-year residency. If you want to do an additional fellowship and specialize in an organ system like cardiology, nephrology, pulmonology, et cetera, fellowships will range from 2 years to 3 years. And then after fellowship, you can further subspecialize. So let's say, you know, I graduated cardiology and I was like, I want to do advanced imaging, which I'm doing. That's maybe another 1 to 2 years. Or I want to do interventional cardiology. They're the guys that, you know, if someone comes in with a heart attack, they go in and they put in a stent. That's another 1 to 2 years. Electrophysiology, 2 years. 1 year, advanced heart failure transplant, where they do heart transplants and VADs, mechanical support, that's another year. So it can keep on going, but I would say average for a specialist is probably anywhere 15 to 15 years in total, including college.
Okay, got it. So the next question is, what are some choices you wish you did differently in high school that might have helped you better your career?
Oh man, taking it back to high school. You know, I don't have a lot of regrets from high school. I mean, I think, you know, I was a little bit of a procrastinator. And so probably just getting stuff done more on time or ahead of time. And then, you know, but I took school pretty seriously. All of my classes, pretty much the majority of my classes in senior year and even in junior year were AP classes. And so you know, if that's a thing that you guys can do, I'm assuming AP is still a thing, please do that, because when you're actually applying for medical school, sometimes some of your AP classes can count towards your pre-med requirements. And that also goes, I even took a couple community college courses when I was in high school. So you can even do that as well. You can do that during college. So yeah, I remember I wasn't as much of a gunner as I am now. But I would just say that procrastination was probably my biggest thing that I probably would work on. But I think other than that, I was okay.
All right. And still thinking about high school, what clubs did you do in high school that has really helped you in your career, or which clubs might have helped if you had access?
So I don't remember joining like a medical school club or I'm sorry, anything health related in high school. I was really active in leadership in high school. And I was really active in sports. I did cross country and track. I did track all 4 years. I did cross country only 2 years. I really excelled in track. Like I was team captain and, you know, MVP and won a lot of medals and all that kind of stuff. And that was something I was super passionate about. And I also volunteered at a hospital. So we had like a local hospital that was nearby my high school. And so I used to go and volunteer there, I think my senior year. And then, like I said, I was also involved in like the leadership councils on campus. I even did like a, you know, dance, like, I don't know. I did a lot of stuff, but I feel like I was well-rounded in that sense because I kind of had like my foot in the door in like several things. And I also actually started becoming involved in like a nonprofit charity organization during high school as well. That wasn't a part of my high school in and of itself. So I wasn't involved in any clubs on campus. I would say though, you know, that if there are any like great clubs to be a part of, I mean, it's always great to be surrounded by like-minded people, because I feel like then, you know, you guys can conjure up ideas together that maybe everybody as a group go, you know, volunteer at a hospital. Maybe everybody as a group can shadow, you know, a couple of people. You can think of ideas to do as like projects. Even, you know, at your age, you can still do, you know, some research projects or get involved in some opportunities, you know, that's related in the healthcare field. And so if you guys have groups like that, then I encourage you to join them. In college, I know that there's definitely groups like that. So I definitely encourage you to join those groups, because that's the kind of stuff that's going to help you on your resumes. But, you know, again, it's important to be well-rounded. You know, don't just think, just because you want to do medicine, it all has to be, you know, healthcare related. Do stuff that you're passionate about, because at the end of the day, they're going to be asking you about that stuff. When you get interviewed, like, they want to see that you're like a normal, I'm not saying that people, everybody has their own version of normal. So I'm not trying to say, you know, I mean, anyone's abnormal, but I'm just trying to say that, you know, they want to see a well-rounded person that is doing things that they're passionate about and that they can talk about, right? Not like this, you know, picture perfect, you know, person who they see, you know, 10 million applications that look like the same. You know, and I'll say, you know, this is a little far away for you guys for now, but you know, when I was in my fellowship and as chief fellow, one of the duties that I had was to interview applicants. And it was cool to kind of be on the other side. And you could tell the people that were just like well-rounded individuals, that maybe they didn't have that much research behind their belt, but the projects that they were involved in, they were super passionate about. And they also were involved in like other things. We looked at those people a lot more highly than we looked at people that maybe had 10 research projects, but they didn't know how to talk about each and every research project because it was just about getting their name in. And, you know, they just seemed like cookie cutter people that didn't really have a personality outside of, you know, just wanting to do cardiology. So the reason why I bring up that analogy is that you know, it's important to be yourself. It's important to do stuff that you're passionate about. And that's going to reflect the most. But yeah, if there's like pre-med clubs, I wish I had that, you know, then definitely join them. Because like I said, like-minded people, y'all can do, you know, good things together.
Yes. So the next question is, I've always heard you need to have a specific goal for why you need to become a doctor, or why you need to be a doctor. Like, not just because I want to help people, specific. Is it true, and does it matter if I don't have a specific goal right now?
I mean, you know, at this stage right now, if you're in high school, I think, you know, if you have this idea that you want to go into medicine, sometimes you're not going to really know. You know, sometimes you're not going to have that much of an idea as to what you want to do, and that's totally fine. I didn't realize what I wanted to do until after I started medical school, right? So I think that's totally fine. I do remember, you know, when I was even being interviewed for medical school, I do remember that they ask you questions like that, which is like, sometimes interview questions are kind of stupid in my opinion, because it's just like, what are you trying to ask? But, you know, so yeah, do you have to have like a little bit of a cookie cutter answer? Sure. But again, it should be reflective of yourself. If you can't really figure it out right now, that's okay. Just think about it. I mean, think about why you want to go into medicine. If it's really just about helping people, then that's okay. But like, have more of an answer than I just want to help people. But you know, you want to be able to move, you know, medicine forward. You're really passionate about research. You want to be able to get involved in, you know, clinical trials to help, you know, move the field forward. You are excited about, you know, if you're a minority or if you're a female, you know, let's say you want to be a part of the field so that you can make, you know, a more of a difference for recruiting more minorities and females in the field. You've seen so many great mentors on social media, or you've met people in your family or, you know, friend circle that are doctors, and, you know, you're really inspired by them. It doesn't have to be some big, you know, cumbersome story. It can just be something super simple. But I would say, think about why you want to do it, get some experience around it. And that means the shadowing, things like this, or, you know, in-person opportunities, talk to your family and friends that are in healthcare, and get an idea as to what you want. And, you know, if it's something you're passionate about, that's going to show, and your answer will show as well.
All right, next question. What do you think is a good SAT score?
Oh God. I can't tell you that. I mean, I don't even think the SAT is graded the same as like I don't even know. I will say back in the day, when I took it, a good score was 1300 and above. Is it totally different now?
Was it out of 1600 when you did? Okay, yeah, that's how it is now.
Okay, okay. So yeah, 1300 and above was considered like good to get into a good school, but it's not the be all end all. Remember that when you're applying for college, it's a curve, right? So there's going to be people that are going to fall right into the middle. There's going to be people that are going to be on the higher end, and there's going to be people that are going to be on the lower end. So that's why other things like your grades matter and other stuff that you're involved in. I will say if you're going to be applying to Ivy League schools or much more competitive schools, understand that a lot of those students are going to have SAT scores that are going to be, in the higher bracket. So just kind of know where you fall. But like I said, back in my day, it was 1300. That was kind of considered this golden score. I don't know what it's like for you guys now. I know that as time has progressed, things have just gotten more competitive in general. Like even where I went to college, UC Irvine is a great, great place. But it's become a lot more competitive to get into UC Irvine now than it was, 10 years ago. So I can only imagine what the scores are like, when I was applying versus like when you guys are applying. So just kind of understand like the rubrics as to like each place that you're applying, kind of what the generally what the past students, maybe past couple of years have had, and kind of where you fall in. If you really want to go somewhere, don't get deterred just because your score might be a little bit lower. I mean, still apply. You never know. I know people with like lower scores that got into great programs for other reasons. So, don't get discouraged, but just kind of know where you fall.
Okay, that's great. So, another question is, to what extent and degree were you keeping yourself up to date with medical field events such as as a student? To be precise, do you recommend us to keep track of the major happenings, news, events in the medical field or the field of choice right now, or the focus should be more on scores and grades?
Oh, I mean, you don't have to keep up to date on research and stuff. That's too much for you guys, right? Honestly, even for me, it's too much. Like, it's too much. Unless you're super interested in something and like, let's say, in cardiology, right? There's been a lot of, I'm just giving an example, but there's been a lot of like late breaking trials and research within advanced heart failure. And a lot of exciting medications have been recently approved by the FDA or leaning towards approval by the FDA for patients with heart failure. And so, that's something that I'm like, passionate about. But do I expect somebody who is much, 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 much my junior, like your guys' level, to understand those things? No. I, at your level, will focus on grades. I will focus on scores, and I will focus on being a well-rounded person. I will not worry about any of that other stuff. If you're interested in something, absolutely, right? I mean, God bless you, if you at this stage know that you want to be a cardiologist, like that's amazing, because I didn't know that I wanted to do that at that stage. But if you want to do that, that's fine. You can interact with some cardiologists on social media, or you can interact with other specialists on social media. Twitter is a great place to do that. Instagram is a great place to do that, just to learn more about the field. But no one's going to expect you at this stage to understand the latest and greatest in terms of research and medical knowledge, because you're just not there yet. I would say that if you were in medical school and you were a resident, then it's a different picture, but you're not there yet. So don't worry about it.
All right, next question. Would doing pre-med at a smaller college affect my chances of getting into a good medical school?
I don't think so. No. I mean, again, it's like, it's so stupid how some of this stuff works, right? I know that names carry some weight, okay? And the reason why I say that is because I might have gone to a great college, but like my medical school is not even a US medical school. And, honestly, it still carries that. I still carry it with me today. And that sucks. And so I get it, right? But I will say that if you do stellar at wherever you are, that's going to be looked highly upon. So Ivy League schools don't just accept Ivy League students, okay? They're really trying to be more diverse in their applicant pool all across the board. You know, great universities are not just going to look at one limited pool, okay? So I would say that if in your school, wherever you are, and you do really good on your scores, I encourage you to apply to wherever you want to go. And I don't think that that's going to limit you in any way.
Okay, so one more question. Do you have any tips on how to shadow or get more experience with medical field, especially in a pandemic?
Yeah, so I mean, this is a great way for you guys to, you know, to shadow, is to talk to physicians, almost like a one-on-one type of thing, and ask questions, because you can get an idea as to what our day-to-day is like. And then I think there's other platforms on Instagram. Like, I know I've done something with web shadowers. I don't know if you guys are familiar with them. And there's like a couple other platforms on Instagram that actually do like shadowing sessions where they where physicians actually go on and break down cases, and they go through, you know, like I did a couple cases of chest pain, and how it was two patients that presented with chest pain, but how I treated them very differently. And so I think that online shadowing right now is like a thing, like virtual shadowing is a thing. So take advantage of it. I mean, social media in this time is like amazing, right? Like, yes, there's some downsides, but in terms of, you know, being able to engage with others and being able to get opportunities like this where you can learn about the field from, you know, physicians, and, you know, especially in a pandemic, like what better way can you do that? So if you can get credit by doing these types of shadowing sessions, do as many as possible, you know, learn as much as possible. I don't think that many people are doing in-person shadowing sessions, unfortunately, because like even within the hospital, like they're limiting the amount of people, unless you like work there, they're really limiting the amount of people that can go into a hospital. And it's probably a little bit less, it's probably a little bit more relaxed in clinic situations like outpatient, but definitely in the hospital, it's a lot more strict. So I just think that, you know, you have to just wait until the pandemic is over. That's going to mean that when we have a vaccine and we have enough herd immunity, people, you know, take everything seriously, then we can start to slowly, you know, relax on those things. Then I think that you can have more in-person situations. But for right now, take advantage of the virtual, you know, shadowing experiences and try to get as much experience as you can.
Speaking of the pandemic, what are the most significant changes you've noticed in your field caused by the COVID-19 pandemic, and how do you think that will affect our generation's experiences in the field?
So, I mean, the pandemic was something that none of us anticipated, right? I mean, but it's just changed all of our lives. And so, you know, in terms of how we practice, I mean, it completely changed the game in terms of me having to see patients every day. I remember initially when we were on like a really strict lockdown, I was doing mostly virtual consults. So that was even in the hospital. So I had the ability to just screen through somebody's medical chart, and if they had like a question that I could just answer with like a virtual consult, I would just do that, and I wouldn't even see the patient in person. Sometimes I would FaceTime the patient or something like that, or if I had to go in, then, you know, I could go in. And then clinic, it became all telemedicine, so everybody was just doing telehealth, and that kind of continued for a couple of months, and then things have kind of eased up a little bit now to the point where everybody's pretty much just resumed their normal day-to-day. We're just always, you know, wearing double masks and gowns and gloves and all that kind of stuff when we're either doing procedures or we're seeing, you know, patients that are like COVID rule outs. But other than that, nothing has really, everything has kind of gone back to normal in the sense that no one's really doing that much telehealth anymore. Unless you're in an outpatient setting, maybe it's a little bit more prominent, but at least in inpatient setting, everybody's seeing patients in person, from what I know. In terms of, you know, what you guys might experience, I think that telehealth is a thing now. And so I think that that's something that's definitely going to be a part of your practice in the future, probably, because people are realizing the utility of it. And so for people that are not able to come in to see you in person, you know, that's a great option to have. So I think that there's going to be a lot more focus and emphasis on telehealth in the future. I think that is the future. I think that telehealth will also come into the hospital. I mean, there's already certain places that do like, you know, they have physicians that are like virtual physicians almost, you know, one of my friends was actually just talking about like a incentive that they have within like these like CVS and Rite Aid like pharmacies. They're actually doing like virtual doctors where you can like go up to a kiosk and you can, if you have a medical problem, you can actually talk to a doctor on a screen. And they're trying to install these like kiosks all across the US. You know, there's all of these great apps that allow, you know, you to interact with doctors. So, and that's already kind of happened before COVID, but, you know, now with COVID, I think that this is just something that's just going to become a part of our practice moving forward in the future. You know, you are a doctor at the end of the day, and there's always going to be sick people, so you'll always have job security. So you don't have to worry about that. So I don't think that that's going to change ever. And, you know, I mean, in terms of like what COVID has done, I mean, I just think that, you know, it's only solidified the importance of us really advocating for misinformation, and for saying that there's a lot of misinformation on social media. There's a lot of misinformation online. There's a lot of misinformation that's just being spread in the public about what COVID is, about vaccines, about the effectiveness of vaccines, about how much COVID has impacted everybody's lives. And so, you know, I think we're really, as healthcare professionals, we have to not allow politics to influence our jobs. And so moving forward, I think that that's something, you know, healthcare workers kind of just have to become like literally a pact, you know, and we just all have to be on the same page as to how we really feel, you know, about certain things, because we can't let politics influence people's lives. You know, people's lives are at stake. But yeah, I mean, I think that there's going to be a lot of changes moving forward. And, you know, there's things that I'm even going to experience that I probably wouldn't have had to experience otherwise had it not been for the pandemic. I mean, it's forever changed everybody's lives. So, but I think for you guys are hopefully will never have to experience another pandemic again, but at least in terms of, you know, things being more virtual and, you know, telehealth, things like that, I think it's going to be heavily incorporated into your practices in some way.
Great. Okay, so I have a question. So becoming a healthcare professional is very difficult. You know, you go through a lot of schooling and it's a very long process. So what is your secret to keeping that focus, and how do you manage work life and learning? So yeah, that's my question.
So how do I keep a focus on like what I'm doing, or
like career-wise?
Yeah, so I mean, I've had to keep that focus in mind for a really long time, right? Because, you know, getting to this point has taken me a long time. And so had I not had that focus, I wouldn't have been able to get here otherwise. So I would just say that, you know, understand that the path to something, maybe it's not going to be my path, which has been unusually a twisty, windy type of path. I anticipate that most of you will have a very straightforward path. I hope for that. But even, you know, with that, medical school is challenging, residency is challenging, fellowship is challenging, and you will have a lot of times where you will question why you're doing what you're doing. But if you remember your end goal at the end of the day, that's what's going to keep you going. So never forget why you went into what you went into. Always remind yourself of that. Always remind yourself that, you know, there's a bigger purpose here, and these small things will not mean anything in the near future. How do I keep myself sane, pretty much, or just have a good work-life balance? I mean, I'm a huge advocate for mental health. So, you know, my mental health has been a struggle during this whole time of me going through medical school and training. And I went through therapy, and it's changed my life. And so I'm a huge advocate for it. I feel like but nobody's immune to mental health issues. I feel like if you're going through struggles and you're not able to deal with things, it's okay to seek help, and it's okay to not be okay. And so, you know, it's very important to take care of your mental health spiritually. You need to be physically active. And so I'm, you know, a huge advocate of that. I run as like a hobby. I love to be active. I love to be outdoors. And then I just love spending time with like family and friends. Obviously, during this pandemic, again, has changed a lot of things. But I mean, you know, now I'm kind of, you know, back to doing more normal things. And so I love to travel. I, you know, love to try new restaurants. I love to, you know, spend a lot of time with my family and friends. I love to relax. I love to sleep. I love to eat, you know, like just normal things. But you have to realize that, like, you know, medicine is a huge part of your life, but it's not all of your life. And so you can't let it encompass you. And so I try to make it this like rule where I leave work at work, and then I just come home and I chill, I do my own thing, you know, because I can't take home a majority of it, or I would go insane. Same thing with social media. I kind of have to cut it off, you know, after a certain point. I need to limit myself. So it's really important to establish boundaries for your own health and well-being, because at the end of the day, you have to live with yourself. So you have to be happy.
All right, so we're running a little short on time. If anyone has any last minute questions to ask, please drop them in the chat now. We'll wait another maybe 30 seconds or so. And if we don't have any more questions, we'll wrap up. Okay, someone's typing. Oh, okay. They just said thank you.
You're welcome.
Yes.
All right, I think we're good.
Good, yeah.
All right.
So, yes, thank you for all your questions. We have reached the end of our meet, so we will not be taking any more.
So I just wanted to thank Dr. Mohamed again for being here today and sharing your experiences, your words of wisdom, and your in-depth responses to all the questions. They've really been amazing. And yep, everyone's just saying thank you now.
You're welcome. I know I talk a lot and I talk in circles, so I hope that you guys understood most of what I said. But yeah, like I said, I love doing this stuff, and you know, I love trying to help and inspire others, and whatever I can do to do that, then, you know, I'm game. So if you guys, you know, want to reach out to me later, feel free to DM me on Instagram or Twitter, and I'd be happy to help in any way.
Great, and thank you for everyone joining today. If you want to see the recording, it should be under the Virtual Meets library on our website, and you should be able to see it later this week. And if you had friends who wanted to attend and couldn't, just give them the link to the website, and they should be able to see it. So yeah.
And in addition, if you guys know any other health professionals that may be interested in conducting a meet with us, please have them email us below. It'll be in the video, or they can DM us on Instagram.
Yes, our next one is on Wednesday, so we'll see you there. Yes, but thank you once again for coming and giving us so much advice. We're definitely going to remember this, and we're so glad we got to have you here. Thank you.
Absolutely. All right, guys, take care. Thanks so much. Have a good day. Hope you all learned something.
Bye, everyone.
Bye.
Bye. Bye.